It is now my pleasure to introduce Dr. Catherine Smart, somebody who probably doesn't need that much introduction in Saskatchewan. Dr. Catherine Smart is a pediatrician in Whitehorse, Yukon. She's the 10th woman to be president of the Canadian Medical Association in its 154-year history. Dr. Smart was raised in Swift Current and has strong ties to Saskatchewan. She has a cemented reputation as a trusted, authoritative voice to advance key priorities for Canadian physicians and the medical profession. Her presidency has been underscored by some of the most difficult challenges healthcare workers have ever faced in Canada. She works primarily with children who have experienced trauma and adverse childhood events, and she witnesses the broad and lasting impact these events have on children and their development daily. Welcome, Dr. Smart.
Thank you very much. And my apologies for your short break because of me, so I'm sorry for that. It's really wonderful to be with all of you tonight. Before I begin my remarks, I'd like to acknowledge that today I'm speaking to you from Toronto, the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. And I make this land acknowledgement with the recognition it must come with action towards real change that honors Indigenous peoples as the caretakers of this land we now call Canada. Thank you so much for the opportunity to speak to you tonight about some of the work that's going on at CMA to support physicians and medical learners in Saskatchewan and across the country. Next slide, please. We recognize that the events of the last 2 years have really driven home the need for us to do more in our advocacy and the scope of our work. The pandemic has laid bare devastating gaps in the healthcare system, but it's also provided what we see as a once-in-a-generation opportunity to create change. At the CMA, we think about driving this change, and we are guided by the following vision. We want sustainable, accessible health systems where patients are partners in care. We want communities where everyone has the chance to be healthy. We want a new culture of medicine that embraces equity and diversity and sustains physicians as people, not only as professionals. Throughout this work, we're guided by 6 principles: engagement, accountability, transparency, impact, equity, and diversity. If we are to succeed, we must stay true to these values. If we are to build a just and equitable future for the profession and for our patients, we need diversity of thought and experience at the board and on our committees. We need to build a bigger tent and engage grassroots physicians of all stripes in our work. We need to reaffirm our commitment to reconciliation and take action to dismantle systemic racism and structural inequalities within the healthcare system itself and in the medical community. We need to hold ourselves and others accountable to our commitments. In short, we're working towards becoming a stronger, more relevant, more inclusive organization. Next slide, please. In my role as president, I've been very grateful to be part of this work, to share the physician experience and our knowledge, and to put pressure on governments to act in the interest of the profession and patients. I want to take this opportunity to thank all of you and commend you in Saskatchewan for speaking out for patients and one another during this extremely challenging time, all while navigating a tricky relationship with your government. It's not easy. Thank you for the support you've shown the CMA's advocacy and for always staying centered on what's best for patients and for each other. While we continue to urge Canadians to remain vigilant against COVID-19 as public measures, health measures lift across the country and cases are spiking in certain regions, we also continue to call for action to strengthen the healthcare system, including the health workforce. Next slide, please. New data from the CMA's most recent National Physician Health Survey has shown us just how profound the consequence of the pandemic has been on the country's health workforce. It's unfortunately no surprise that we're now seeing record high levels of burnout amongst physicians, more than twice what we were seeing pre-pandemic. We're also seeing physicians tell us they plan to step back from their clinical work and take time to recover. Our survey showed us that almost half of physicians are planning to reduce their clinical hours in the next 2 years. I've recently seen work by the SMA that has really shown the same thing, and I think it's just a reminder to us about the importance of wellness, and it's helping us also to better understand how the pandemic has affected physicians from across the country. Next slide, please. We've also unfortunately seen a huge rise in misinformation and in personal attacks, threats, and harassment towards healthcare workers. We felt we had a big win in January when Bill C-3 was passed and came into effect, which made it a criminal offense to intimidate, harass, or threaten healthcare workers in person and online. I'm proud of the role CMA played in making this happen and how it will protect physicians and other healthcare workers. While we continue to support physicians at the individual level with our advocacy, resources, and support, we also recognize the need for broader cultural and systems change to address the crisis we're seeing across the system and with the health workforce itself. Next slide, please. We recognize that informed solutions will depend on broad input, inclusive dialogue, and significant action. Earlier this spring, we hosted a Human Health Resource Summit in partnership with the Canadian Nurses Association to hear from representatives from health and social organizations from across the country on the actions that are needed now. Top of the list was creating a robust data source of human health resources and implementing a multidisciplinary nationwide health human resource strategy. We're seizing opportunities to be leaders and influencers in this space, for example, sharing these solutions with the federal government and underscoring the need for them to develop a pan-Canadian health workforce plan in collaboration with all levels of government. We also continue to bring together physicians, patients, policymakers, and others for broad discussions on how to do health differently through our Health Summit series. 2 sessions this month will focus on how to create a health system that's an engine for economic growth. And the final session in June will explore how to rebuild the health workforce. Please visit cmahealthsummit.ca for more information and to register. Physician engagement is incredibly important as we work towards solutions in these and many other areas, so I hope to see you there and hear your voices. I think there's never been more need for physician leadership and for our voices to be heard than what we find today. Next slide, please. Another form of support we're showing for physicians during this time is through funding to provincial and territorial medical associations, including the SMA. Next slide, please. For example, through the CMA's affinity agreement with Scotiabank and MD Financial Management, the SMA received $1 million in funding to support physician wellness initiatives over a 4-year period starting in 2020. The CMA Foundation has contributed more than $860,000 to support various Saskatchewan medical schools, municipalities, community hospitals, long-term care facilities, and frontline physicians and other medical professionals. Through the CMA PTMA Memorandum of Understanding, SMA is receiving $300,000 over 3 years for physician leadership development. This MOU is also providing funding for a health policy research collaborative that will benefit all provincial and territorial medical associations. The CMA has a sponsorship agreement worth $37,500 with SMA and the University of Saskatchewan for a 3-year pilot to deliver an Indigenous sensitivity training cultural awareness course to 4th-year medical students. Next slide, please. Having served at both the territorial level and now at the CMA level, I have a new appreciation of the relationship between the national and the PTMAs, especially through the pandemic. And I think that relationship is of critical importance, and it will really be behind the work we do as we drive forward together towards health system transformation. I certainly understand the many challenges that smaller associations like the SMA and us in the Yukon face. And at the same time, I see the tremendous benefit we get from connecting to share our concerns and work together and learn from each other regarding what the solutions might be. I look forward to continuing the conversation with your new president, Dr. Jevry, and I would like to take this opportunity to thank Dr. Claire Kozrowski for her continued work on the CMA board. Next slide, please. Thank you so much for having me tonight, and I'm looking forward to our next piece, which is the CMA Honorary Membership Awards. Am I able to go straight into that, or did you guys have something in between?
I wonder, Dr. Smart, could we see if there's any questions?
Yes, please.
Thank you very much, and thank you for joining us, and thank you for that address, and thank you for your work as CMA President. Are there any questions? If you would like to ask Dr. Smart a question, please raise your hand in the Zoom virtual room.
There are no questions at this time.
Thank you. I think, Dr. Smart, people are excited to celebrate the CMA honorary members, so let's go ahead with that, please.
Okay, wonderful. Thank you. It's Now my pleasure to award this year's CMA honorary memberships. I'll be recognizing 4 individuals who've distinguished themselves throughout their career by their attainments in medicine, science, or the humanities, or by significant service to the association. So we will go in alphabetical order. The first recipient is Dr. Bruce Burchide. Dr. Burchide received his medical degree from the University of Saskatchewan and is now retired after working as an interventional radiologist for more than 30 years at St. Paul's Hospital. During that time, he was active in the St. Paul's community, serving on its local council, the Emmanuel Health Board of Directors, and the Hospital Foundation Board. He was also involved with the SMA, recently retiring from its insurance committee after 23 years as chair. He also served on the SMA board from 1989 to 1994 and on the board of the Canadian Association of Radiologists. In his retirement, he hopes to remain involved in healthcare in different roles and looks forward to traveling more with his wife Barbara, a longtime St. Paul's Foundation board member and a palliative care volunteer. Congratulations, Dr. Burchide. The second CMA honorary membership goes to Dr. Jamie Harris. Dr. Harris obtained both a BA in history and his medical degree from the University of Saskatchewan. He practiced family medicine for 2 years in Kindersley before moving to Prince Albert in 1983. He served on the SMA board from 1986 to 1992, represented the SMA in negotiations with the Ministry of Health, and served a term as a member of the Joint Medical Professional Review Committee. He's a medical advisor to the Prince Albert Grand Council on a project to develop an Aboriginal-based medical clinic in the region using a patient medical home model. Since 2009, he's written and published 3 books that combine his interest in history and his passion for golf. Congratulations, Dr. Harris. The third CMA honorary membership goes to Dr. Jeffrey McCarroll. A 1982 graduate of the University of Saskatchewan Medical College, Dr. McCarroll joined the surgical department in 1988. He continues to serve as a professor of surgery in orthopedics and also held the role of chief of orthopedics for Saskatoon City Hospital and the health region. His interests include reconstructive orthopedics, sports medicine, arthroscopy, and trauma. Throughout his career, he's been heavily involved in a range of orthopedic and medical groups and national and provincial professional associations. This includes memberships in numerous SMA and health region committees, plus work with the CMA and City Hospital Foundation Board. And most importantly, he lived down the street from me in Swift Current, Saskatchewan. I used to visit his home regularly as a child, and he operated on my mom and fixed her ankle. So thank you, Dr. McCarroll, and congratulations on your honorary membership. Last but not least, the fourth and final member to receive a CMA honorary membership is Dr. Sandra Worth. Dr. Worth retired in 2014, 35 years after graduating from Queen's University Medical School. Following internship and anesthesia training in Winnipeg, she spent 2 years doing locums in rural Saskatchewan and Prince Albert. In 1983, she joined the Rostern Medical Clinic, where she provided full-scope general practice, including clinic work, obstetrics, anesthesia, inpatient and ER hospital coverage. She also commuted to Humboldt for several years to provide anesthetic services before joining the SMA locum program in 2009. She served on numerous provincial and national bodies, the SMA board, the Medical Compensation Review Committee, and was Saskatchewan's representative on the CMPA Council for 9 years. She looks forward to enjoying her retirement with her 2 children and 6 young grandchildren at Delronde Lake. Congratulations, Dr. Worth. Congratulations to all 4 individuals. What an incredible example of service to their communities and to the medical profession. Thank you all for your service.